Good afternoon, everyone. Thank you, as always, to our partners in the media for being here today. I am joined by two people who need no introduction, Dr. Michael Apostolakis, Chief Medical Officer for UR Medicine, and Dr. Rob Mayo, Chief Medical Officer for Rochester Regional Health. I'd like to begin today with a few brief remarks, and then the three of us, we can take your questions following that. I know that vaccination planning and execution is the topic of the day, but I want to pause and remind everyone that we are still in the middle of a pandemic, and we will be for months to come, even as people get their vaccine. In our region, more than 800 people are in the hospital right now battling COVID. 134 of them are in the intensive care unit, and people continue to die from COVID at an alarming rate. As you consider gatherings with people outside of your household over the coming week or two, I urge you to consider those families who have lost a loved one to COVID-19, families for whom getting together will forever carry a new meaning. And while it is simply human nature for all of us to want to be together during this very special holiday, our traditions could very well make somebody who we love very sick. So we are seeing this over and over in our contact tracing: a Christmas cookie decorating party, a wine date with a handful of friends. As harmless as these activities seem, they are examples of how this virus is spreading in our community today. So just because somebody tests negative in the day or two leading up to your planned gathering, it does not mean that that person can't bring the virus to your dining table. COVID-19 could be an unannounced guest. It is opportunistic and not always obvious. So please, in honor of those families who will be mourning a loved one this holiday season, I urge you to do your best to help stop the spread of COVID-19 in our community. Now, just a brief word on vaccinations before we take questions. While we still have to finalize many details, I know that there are some very good people across the community and the Finger Lakes region working literally nonstop, even through the holidays, to put these plans in motion. We are aligning our efforts, which takes time, but ultimately this work will lead to equitable and efficient distribution of the vaccine to everyone, beginning with those most at risk of contracting the virus or suffering serious side effects from it. So with that, I'd like to again welcome Dr. Michael Apostolakis and Dr. Rob Mayo, who are here to help answer your questions.
Thank you. And we're going to start today with Jennifer Lukey from WHUC.
Hello, good afternoon. Dr. Mendoza, earlier today, the governor said, oh, can you hear me okay?
Yeah, we can.
Sorry, go ahead, please.
Dr. Mendoza, earlier today, the governor said that he is in communication with Monroe County and our local hospitals and, quote, we're considering several options, unquote, to try and control the spread. Can you be more specific on what's being considered here?
No, I'm not actually sure what he's referring to. I think, to my knowledge, there hasn't been any change in the orange and yellow zone strategies. So no, I can't comment on what he might be referring to.
Have you been in conversations with the state?
Oh, certainly. We've been in conversations with the state all morning around the vaccination issue. That's been the big topic for us for today, but I haven't heard of any updates otherwise.
Okay, and Dr. Apostolakis and Dr. Mayo, we're seeing obviously the hospitalization numbers continue to tick up. I know that we're with plenty of capacity, but if you could just sort of give us a feel for what your staff is experiencing inside the hospital now and what your concerns are over the next 5 to 10 days.
Yes, I can speak for URMC, and I can tell you our staff is doing a great job, but they're stressed and they're stretched. They're doing overtime. We're hiring travelers, and everybody's pitching in to take the very best care of our community as we can. But my concern is that the numbers of admissions continue to creep up. That the one thing that the community can do for our healthcare providers this holiday season is to stay socially distanced, to have their holidays virtually, to really stay with their nuclear family so that we all can enjoy a better holiday season in 2021. I am concerned about the unnecessary deaths and the people that won't be here next year because of choices we're making today.
Dr. Mayo, do you have anything to add?
Yes, thank you. I certainly share very similar concerns, and Rochester Regional Health Hospitals are quite stretched and quite strained with the number of patients that are in the hospital. We have over 600 patients in Rochester General, for example, and across our health system, over 450 COVID positive patients. Many of these patients are in our ICUs, and our ICU staff is very stretched, and this is a very big concern as we shift staff to manage the care of these patients, and as we try to manage the resources needed for them. So the message couldn't and shouldn't be too loud. It must be as loud and as clear as possible that we need the help of the community to manage the spread of the COVID infection and reduce the impact of the pandemic here locally.
Thank you, Jennifer. Daniel Kushner from City Newspaper.
Yes, hello. This question is for Dr. Apostolakis and Dr. Mayo. I'm wondering if you might be able to speak to how the immunization plans and protocols have been affected in your hospital systems. If you could give us any updates as to the extent to which your staff has been able to effectively been immunized, and what the progress is with that.
Sure, maybe I'll go first this time, Mike, and you can follow. Yeah, well, the vaccination process is very exciting. This has been a long-awaited day, and that we've received the vaccine with, joyful hearts. Because the vaccine delivery process has been protected by confidentiality, we have not known, except for a couple days beforehand, how much vaccine we'll be receiving and when we'll be receiving it. And so that has, created some challenges in letting people know ahead of time, coordinating all of the vaccine efforts. So for many of our employees, receiving the vaccine in the first couple of clinics felt bumpy and a little erratic, but now we've got a very smooth vaccine process going. We have followed the Department of Health guidelines on how to prioritize and how to sequence the vaccine administration. And we're very pleased that so many employees have received it. As of the end of the day, we'll have nearly 2,000 employees vaccinated, and we're looking forward to partnering with the Department of Health and community leaders to continue to continue to vaccinate the community.
Yes, I too want to echo at URMC, our faculty and staff are excited about this vaccine, that they see this vaccine as the beginning of the end of the pandemic to get back to a normal life and caring for non-COVID illness and enjoying time with their family and friends. As of yesterday, over 3,600 faculty and staff had received vaccine from throughout our hospitals in the region. At Strong yesterday, we vaccinated a total of over 2,500 to date. And today we expect to go over 3,000 vaccines administered to our employees and faculty. We've, as RHS has, we have followed the DOH mandate of prioritization, prioritizing those that work on the front lines caring for COVID patients on a daily basis. The process isn't perfect. As you can imagine, it's very difficult at all times, especially with some staff, being off on certain days and we not finding out whether we're getting vaccine till the day before to schedule all. And so there are at times where we're looking for people slightly lower on the list to make sure that vaccine doesn't go to waste. And I think at times that leads to misunderstanding. And I think this is a lesson for our community as it gets spread out through the community, that this is a valuable resource. We are going to do our very best to prioritize to patients as they need it, but they also have to understand that prioritization of 900,000 people in our region can be difficult, and it's going to take time. It's going to take patience, but I think our government is doing a great job. Our state Department of Health, our county government, and we're going to do our very best to assure that our community is fairly treated and gets the vaccine they need and deserve.
Do you have a follow-up, Daniel?
Yes, I do. My follow-up question is for Dr. Mendoza. I'm wondering if you could speak to any updates that there might be with regard to the COVID task force that has been assembled, led by Dr. Bennett and Mr. Norwood. If there have been any, if there's been any tangible progress to report so far.
Sure, lots of behind the scenes work right now. You know, the primary challenge of this task force is ensuring that we've got representation from across the region. And so just this morning, we had conversations at a regional level with all of my counterparts across the region, and very similar conversations. We're trying to understand what their needs are so that we can inform the formation of the task force, which will be coming probably within the week.
Next up, we have Tanner Jubinville from 13 Lamb.
Hi, good afternoon. I want to ask about going back to the hospital situation. I guess this is, at least with Rochester Regional, we heard there's hundreds in the system. And I know just a few weeks ago, and there were a little over 200 in each system. I mean, that was already way worse seemingly than the spring surge. So going into the final days of the year and the first days of 2021, really, what are your chief, this is for both Dr. Apostolakis and Dr. Mayo, what are your chief concerns really heading into next year?
Yeah, that's a great question. Our chief concern heading into the new year is a concern over the bounce in the number of cases of COVID-19 caused by this double holiday. At Thanksgiving time, people may spend a day or two at home and have a meal or two together. During this holiday season, with a couple of holidays so close together, people tend to stay longer. They tend to visit friends when they're in the area. I'm concerned about too much socialization, and that right now our systems are able to care for both COVID and non-COVID illness. And if we can keep the cases down, I'm confident that we continue to do so. However, many are predicting quite a bump in the number of COVID-19 cases. And if that occurs, we're seeing a pretty steady number of 10% of all cases are being admitted to the hospital. And if we see a significant bump in cases due to the holidays, this will stress our systems, and we'll be able to take care of less non-COVID illness. Right now we're titrating, and we've delayed some elective cases, but this could push us to delaying all elective cases and possibly shutting down all of ambulatory surgery in order to bring in staff to care for COVID patients. I'm loath to say that, because when we did this in the spring, we saw what was an elective case become an urgent case, and we saw non-COVID illness cause significant harm because of preparing to take care of patients with COVID. So I can't emphasize enough that how much we want to partner with our community to help us as we help them. And if we can prevent cases of COVID-19, we will save lives, we will protect our staff, we will be able to care for you in the way you deserve to be cared for. So I can't plead hard enough for the community to hear this message and to help us help you.
And I echo the exact same sentiments. Rochester Regional Health has taken similar measures. Over the last few weeks, we have reduced the number of surgeries in our hospitals, moved as many to the outpatient ambulatory surgery centers as possible, and then postponed some of them so that we could free up staff and care for COVID patients. The ambulatory practices have shifted a number of their staff, both physicians, nurses, and other non-clinical staff, to support the hospitals and the care needed to manage the COVID needs. So So patients in the community may experience longer waits and other delays with ambulatory care now, and that may need to be further advanced in an effort to free up resources to support the more acutely ill individuals in the hospital. So that's one of my big concerns as we face the new year, that the pandemic will continue to worsen and our ability to manage the broad spectrum of clinical care will be narrowed further, and the community will feel that impact.
Thank you. And this might be more for Dr. Mendoza, but wanted to ask, I guess, I know we're probably still a few months away from general population getting the vaccine, but I guess what plans are being discussed, or I guess, is there a protocol you're getting or drafting about, making the blueprints to really get this vaccine to the wider community?
Yeah, this is what we've been preparing for. We have plans to do this. We will not be able to do it alone. As I've mentioned, this will be the largest public health undertaking of our generation. But right now, we're really focused on getting it right early. And so making sure that the healthcare systems are vaccinating their employees. They are at greatest risk. Nursing homes going through all of the tiers. Our focus really is on tier 1 right now. The plans as they unfold for the general public are under development, and we're going to have to adapt as we learn from how we're doing it in these early months. Oh, and the other reminder I want to offer up is, I know that a lot of people are wondering when they will be up next. We're actually asking you not to call your doctor about this quite yet. We will reach out to you when the time is right, when we have information. But right now, our doctor's offices are swamped, taking care of all of the usual things that we're swamped with in the wintertime, in addition to all of the questions around COVID. So with the vaccine, we will reach out to you when we have information about how to get the vaccine for the general public. But for now, we'd appreciate your patience on that.
Thank you, Tanner. Up next is Sean Lehman from the DNC.
Yes, hi, Dr. Mendoza. We heard from Dr. Mayo and Dr. Apostolakis about how many vaccines they've administered already. Is that something that you intend to track at the county level as we start to move forward?
We certainly want to track that at a regional level. The fact of the matter is that we're not through this until we're all through this. And so that is data that we are working on right now. Tracking all of this, as you can imagine, is going to be a huge undertaking in and of itself. And we're coordinating all of that through the hub, the regional hub, which is currently U of R Strong Memorial. So we're pooling our resources across the counties to ensure that the hub has the information that they have, that they need in order to report that. But we need these data because it's how we're going to know that we're actually following through on our goal to be equitable and fair as this vaccine gets rolled out.
Gotcha. And on a different topic, do you know, with regards to testing at the county rapid testing sites, is testing capacity going to be reduced during this holiday period?
I have to look at the schedule to be specific on that, but I think just because of the holidays and the availability of volunteers, it will be reduced a little bit. But we certainly want to keep testing into the new year. So no, we'll definitely be testing in the new year. So.
Okay, thank you.
Noelle Evans from WXXI.
Hiya. So just for clarity, do you have a number of how many long-term care residents have been vaccinated in the region, Dr. Mendoza?
I do not have that figure, no.
Okay. And then for both hospital systems, is there an idea of the percentage of long COVID cases that you're seeing, and what that looks like in terms of the care that they might need?
I can tell you for our patients that we've cared for during the spring, our average length of stay for COVID patients was about 18 days. Remember back then, there were more ill patients, more severely ill, and about half of them were intubated on life support. This time, it's not the same. Less than a third of our patients are on ventilators, and our average length of stay is only 9 days. The severity of illness is not what it was before, but we have many times more patients. And because of that, we're now seeing almost equally the number of deaths we saw in spring. So although the severity of illness isn't as bad, the total number of deaths is the same because of the marked increased number of cases we're seeing now.
Okay, just to clarify, when I say like the long-term COVID cases, those who might need care after they are in the ICU, those with symptoms that remain for weeks to months after the initial infection.
I'm sorry, are you asking how we care for them, or are we seeing more long-term
The,
side effects?
more just the number or percentage compared to those who recover at a faster rate.
Oh, the percentage of those that are having prolonged symptoms is percentage-wise less than it was back in the spring. But because there's so many more patients now, the total number is increased.
Anything to add, Dr. Mayo?
Oops, my response would be the same.
Okay, thank you.
Andrew Freeman from Spectrum.
Hi, good afternoon. Thanks, everyone. We talked about projected capacity and your concerns post the holidays, but I was wondering if the hospital systems could provide an update on capacity as it stands right now and talk about any plans that are being made or implementations that are already in place for moving patients out of the region if needed, if capacity continues to surge.
So presently, one of the tactics that we use to help manage the needs of these patients and balance resources is called load balancing, where we may transfer patients from one hospital to another, or we might direct an ambulance service to take a patient to one of the emergency departments. And so that's a common practice that we've done for many years, but certainly during the COVID pandemic, it's been a helpful tool to bring patients and resources together as quickly as possible. So that's going to be remain an important activity. The other thing that we do is we bring staff and the skills that they have to patients. And that's, we call that redeployment, and we provide staff with additional training if needed. And then we move them and change their job descriptions temporarily to help address the needs of the community and the patients. So there's a lot of, and those are just two of many of the ways that we are working internally to shift resources and get them right at the point of delivery for the patient. There are times too that we may be transferring patients between UR Medicine and Rochester Regional Health, and we have also done that for years, and we will continue to support each other as we care for this community.
Yes, at URMC, we're doing similar things. We already are load balancing, and we've transferred patients out of Strong into the region, and have sent some patients from the region here. We've been load balancing surgeries. We've moved surgeries to different facilities where there's more staff, and we've done this all to care for our community and our regional community. I can tell you that eventually we're going to get to a point where we've done all the load balancing we can. We've done all the held all the surgeries that we can, and that we'll just have to cut back on ambulatory care, cut back on surgeries in the ambulatory area as well, and bring staff in to care for more and more patients with COVID. And that's why, I'm going to sound like a broken record, but we can put this pandemic behind us in 2021, and I believe we will with vaccine. We just need to hang on for a little longer, and the community is what we need to help us flatten the curve and avoid having to limit the care we give to you, our patients with non-COVID illness. We can prevent as a community COVID spread. We can prevent COVID admissions to the hospital, and we can make all these discussions about withholding COVID care never materialize. So please help us help you.
Quickly, Andrew, a follow-up.
Yeah, I was just, what's the capacity like as of today? How are the hospital systems looking right now as far as patient loaded capacity?
Right now at URMC, we're at our average capacity. And we can surge and make the necessary beds required by the state. And we do that by calling in staff working overtime, using travelers, et cetera. But eventually we get to a point where we hit our surge capacity, and the only way to make more beds is to stop ambulatory care and ambulatory surgeries. And that will markedly increase our capacity by 200 to 300 beds. But it comes at a cost of not getting the elective care or the non-emergent care that patients want and deserve.
Our final question from
Yeah.
at WROC.
Or I'm sorry, I was just wondering if Dr. Mayo could talk about capacity there.
Yes, I'd like to respond as well. Thank you. Rochester Regional Health is definitely above its average capacity. In the last couple of weeks, we've added over 200 inpatient beds to our hospitals. We've done that by ordering ahead and purchasing ahead equipment that we had in our strategic reserve that was required by the executive order earlier this year, and then by bringing online the areas of the hospital that were either ambulatory areas or that were units that I would just call in transition. So as you know, Rochester General Hospital opened the Sands Constellation Center for Critical Care about a month and a half ago. And so as we have shifted into that building, it left some empty spaces in the old building. So those spaces have been continued as inpatient care areas. So it's been a lot of additional beds, and we still have space to expand. So we haven't exhausted our surge space, but we are definitely above our average capacity. And so we do need the community to really redouble their efforts to help us with stopping the spread of this infection. I couldn't reinforce the impassioned statements of Dr. Apostolakis. I feel similarly, and we really need the community to do their part.
Thank you, Dr. Mayo. Now our final question is from Christian Garzone from WROC.
Hey, can you guys hear me okay?
Yep.
Yes.
Excellent. I'll just ask one question. Now, we've talked about so much. My mom's from the UK. What are you all hearing about this secondary strain of COVID-19, this mutant strain? Are we concerned here about that? What have we heard so far?
Well, I'll start out by saying that we are very concerned about this. We don't have the genomic surveillance here in this county to know whether it's here or not, but I think it's a safe assumption that it's in the United States. And I think at the end of the day, the message to the community is still the same. All of the things that we've been saying, all of the precautions that we've been taking to date are the same ones that we want everybody to consider in light of this new news. We are currently under the belief that the vaccine will prevent subsequent strains, including the one that has been reported in the UK and in South Africa. But again, we're continuing these studies, and as we learn more, we'll share it with the public.
Excellent. Just want to thank you all for your time today. Thanks so much.
And thank you. That's it for questions. Have a great holiday, everyone.
Thank you all. Happy holidays.
Thank
Thank you.
guys.
You
Happy
too.
Thank you.
holidays.
Take care.